Test 1, 2, 3. We're going to go ahead and record this procedure. It's tooth number 30. Implant is a external hex Brandemark. There was prior access by a dentist approximately 9 to 10 months ago. We're going to go ahead now and pre-soak the top of the fixture. This is the occlusal aspect. We're going to go ahead and dry that and dry the mirror. And you can see from the prior access outplace that there is an attempt to create a pilot hole in the middle, and then they deviated toward the buccal, and now it's apparent that the first thread has been abraded, which is going to make it somewhat difficult. But we're going to do our best. We're going to pre-soak first. Let's see if we can loosen up some of the bioburden, and then move forward from there. Please retract the lingual. So right now I'm using a solution from the denture people. We're going to use tartar and stain remover. You can also see, if you're looking straight down at the oval or the circular portion of the hex, how much it's abraded toward and annealed actually toward the distal lingual, and that's from movement of the previous crown. Perhaps when it was loose, the abutment was rubbing up against the and fulcruming back and forth in that conical connection area. So that's apparent as well. So we have an abraded first thread, and we have deformation of the conical connection. The external hex also shows signs of wear and tear at each of the 6 points. You can see rubbing and wear of the points itself. The flat portion of the fixture is intact. There are no fractures that I can see, and it is flat. And so that covers the description of the occlusal aspect of the fixture. Pre-soaking. Soaking takes about 10-15 minutes. Try to get that material to dissolve slowly. Most of it's just tartar, maybe some food particles. If you're lucky, you get some movement out of this fragment. So we always go to a counter-rotational movement, just try to see if there's any movement at all. We do see the dissolving of this material. The clear initial clarity of the solution now is becoming cloudy, which means that it is dissolving. The bioburden, calculus, tartar, food particles, anything that's from the body itself or foreign bodies, they pile up inside and they kind of stick to the metal, especially at the crevices. Hand wipe. And you can see how cloudy that is now. So now it's time to rinse it off. and we'll have a look. Okay, so we can see now more of the implant body, top of the body now. So we'll go one more time in there to soak. That's the top portion. This is under magnification. So it's clear going in. And that's filled all the way to the top. We'll just give it a few minutes now. Let's see if we can get any more out of that. So that's the second round of pre-soaking. We also put a little bit of machine oil in at times to try to penetrate in and around the threads of the screw fragment. And again, while that's soaking, I'll take my Explorer and just see if there's any movement. And now we're going to rinse it again. Okay. Rinse it one more time. Actually, I'm going to soak it one more time. Okay. Okay. Let that soak in, penetrate. We're going to come back on the next segment. It's Dr. Gerard Cuomo, tooth number 30. It's an external brand mark with prior access from another dentist that we're trying to make good here. Looks like a drill out procedure. We're pre-soaking a third time right now. Back in a